Welcome back to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in healthcare headlines. Today, we're bringing you a special episode. On Monday, June 16th, 2025, the United States Senate Finance Committee, which has jurisdiction over federal healthcare programs, released its reconciliation bill text, and the proposal is more dangerous and devastating for rural healthcare than the House version, which in and of itself was devastating. While several provisions around Medicaid are still very similar to those in the House Resolution 1, we call it, which was a reconciliation passed by the House on May 22nd, the impact of what the Senate has done, we feel, is more devastating due to provider tax, state-directed payments phased down, and eligibility and reporting requirements that are more stringent. The Senate is still working towards its goal of passing this bill before July 4th. And with very little time remaining, I want to summarize some of the main changes and encourage our listeners to reach out to your elected officials. Now, in the Medicaid proposals, the provider tax is really what is at play for many of us. There are expansion states and non-expansion states. And for the expansion states that have already received the approval for the provider tax, that would be phased down to 3.5 between 2027 and 2031. Now, this is not in the House Resolution 1 and goes even further for those expansion states like Michigan to strip them of this funding. And this would apply to all providers except nursing homes and intermediate care facilities. This is among the most dangerous of the legislation that was passed. Now, in that, there are state-directed payments as well. We call them SDPs. And the non-expansion states, the SDPs were limited to 110% of Medicare rate. In the expansion states, it's limited to 100% of Medicare rates. That's right. So existing straight-directed payments would be phased down by 10% annually until the allowable Medicare-related rate is reached. Now, hospitals in rural communities such as ours that participate in the expansion, for example, the state of Michigan, rely on the average commercial rate, which is higher than the Medicare reimbursement. Hospitals are not gaming the system. We are participating in an allowable program that has been vetted by CMS and the federal government. I would encourage you that as you listen to all of the political pundits and listen to the political assailants who want to strip us of this funding, that you remember this will have a dramatic impact on the ability of hospitals in rural communities like the one you live to provide the service at the same level and at the same level of care and remain open would dramatically be impacted if this does pass. Now, there's other issues, work requirements. They're moving some of that around. We know one thing, that when we start talking about work requirements and we start focusing on work requirements, what we have to remember is we're serving a population in rural communities, a population that's heavily reliant on Medicaid because they are also what we call the working poor. These are the individuals that go into the gas stations, the mom and pop shops. These are our pastors, our farmers, individuals in our communities and in our families who are working, who are spending their time caring for their children, some of them moms taking care of 2 or 3 children working at a local grocery store that offers no insurance because they're under 50 employees. These are individuals that need the insurance. There is a gap that needs to be filled, and Medicaid has filled that gap. To believe that individuals are sitting home, watching TV, playing video games, and gaming the system by cheating, that notion is unrealistic. We know that in order to serve the population that we are in rural communities like Hillsdale, that we rely on Medicaid. Not only do we rely on Medicaid to fill that gap, and so do the patients, we also rely on provider tax to provide the reimbursement at a rate that covers the expense of delivering the care. Now, there's other areas that are of significant concern with this legislation as well. Among those is the retroactive coverage that we have been talking about for the last few months. Currently, we have a 3-month look back or retroactive enrollment into Medicaid. This impacts our skilled nursing facility, patients who were admitted to the hospital from the emergency department. We have the ability to go in, make sure that the individual can receive their application, help them through that process, get them qualified for Medicaid, and that takes a time. And during that time, Medicaid will do a look back, and they will grant that coverage up to 3 months in retro. That is extremely valuable to both the patient and to the healthcare providers and hospitals. And this is going to be scaled back to 1 month. That is a significant concern. And we would just ask our listeners today that as we talk about all of these changes, provider tax, state-directed payments, work requirements, retroactive coverage, that you lift your voice. We must all lift our voices together and oppose these direct hits to the Medicaid program throughout our country. The Michigan Health and Hospital Association, also referred to as MHA, has developed a Medicaid toolkit to help us raise our voice. And you can go to MHA.org. But if you live outside of Michigan, contact your local provider, contact your state office of healthcare and hospital care, and ask them how you can advocate to make sure that the representatives in Washington, D.C. hear your voice. We cannot allow these cuts to our hospitals, and we must speak out today to keep our rural hospitals open and serving our communities. Listen, it is projected that if this bill passes, the already 800 plus hospitals that were identified at risk of closing in this country would accelerate to over 300 hospital closures by the end of this year alone, with hospitals impacted in every state and mostly all rural hospitals. These are in rural communities where transportation is already a barrier to receiving care, as well as gutting hospitals who are the economic engines serving as sometimes the first, second, or third largest employers in the region. Not only would this delay care for patients, remove access to local care, it would close down many needed programs in rural communities like obstetrics and psych services, and in many cases, it would require the hospital to even shutter their doors. Gone forever. Your voice is needed now. If not you, then who? If not now, then when? Today is your day to let your voice be heard. Join us in the fight.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.